Hello friends, today we'll talk about stroke and I want to summarize all about stroke, the 10 important points. So number one, what is stroke? So stroke occurs due to abrupt lack of blood supply to a specific part of brain. Number two, what are the two types of stroke? So the first is ischemic stroke where the blood supply to a part of brain gets blocked. And the second is hemorrhagic stroke or brain hemorrhage where a blood vessel ruptures and blood leaks into a part of brain. Number three, what are the symptoms? The commonest symptom of stroke is paralysis or weakness of one half the body, that is weakness of face, arm or leg. The second is difficulty in speaking. The person may have difficulty in understanding spoken words or speaking. And then the third type of symptom can be imbalance while walking or sudden severe headache. And also visual symptoms like loss of vision in one eye or one half the visual field. So these are some of the common symptoms of stroke. Number four, how do we make a diagnosis? So brain scan is a must. So initially CT scan is done. The purpose is to rule out brain hemorrhage. The ischemic stroke may not be seen on the CT scan, but we don't need to confirm the ischemic stroke diagnosis in the emergency phase. So that brings us to the emergency treatment of stroke. So the emergency treatment which can change or which can improve the outcome in stroke, it is called thrombolytic therapy or the clot buster therapy. It should be given in the first 4.5 hours. The other type of intervention is called as mechanical thrombectomy, where the clot can be removed from the blocked arteries, and there the window is slightly longer, 6 to 12 hours also, depending on the symptoms and the amount of salivary brain tissue. Number 6 is what are the common risk factors for stroke? So they are hypertension, diabetes, abnormal lipid levels, high homocysteine, smoking, alcohol abuse, lack of sleep, stress, and also positive family history, cardiac risk factors like prosthetic heart valves, atrial fibrillation, clot in the heart. So these are some of the common risk factors which can increase the risk of developing stroke, and also older age. Is there a role of surgery in stroke? So usually stroke is treated by medications and intervention, what I just discussed, but in few situations surgery may be required. Number one, if there is stroke affecting the back of brain, cerebellar stroke, there the mass effect or the pressure can build up where to save life surgery may be done. And the second is if it's a hemispheric, one side of the brain is infarcted or the large bleed, then again the mass effect or the pressure on the brain may be severe, and to relieve that there is something called as decompressive hemicraniectomy where the bone is removed from one side to relieve the pressure on the brain. So there are two types of surgery which may be required in some small number of patients. And then post stroke, what are the most important thing? That is the physiotherapy and rehabilitation. So they play a very important role. So after discharge, even in the hospital, the exercises, speech therapy, they are started, and they play a good role in the recovery. The ninth point is about stroke recurrence. So people who develop stroke once, they have a risk of recurrence of stroke in the future also. So for that, the risk factors, whatever are known like diabetes, hypertension, should be controlled. And also the doctors will be giving medications like antiplatelets like aspirin, clopidogrel and statins. So they should be taken. Generally these medications are required lifelong to prevent a second stroke. And the 10th point is what are some of the symptoms which can happen in a stroke survivor. So one is post-stroke epilepsy. So some people after stroke they can get seizures or fits, that is called post-stroke epilepsy, which requires anti-seizure medications. And then post-stroke spasticity, where the tone can increase in hand or leg. So that also needs treatment with physiotherapy and sometimes Botox injections. And then some people can have post-stroke depression, post-stroke aphasia. So these are different complications that may occur in a small number of people who have suffered from stroke. So I hope you learned something about stroke. Of course, it is not very exhaustive, but I'll be happy to receive your feedback. And if you have any queries or doubts, have a great day.